Well, just remind everybody, going back 5,000 years ago to the days of the pharaohs and the Egyptian physicians, there's been thousands of failed medical theories every century, including the 20th and 21st century, no different. Let's look at some of them. Of course, doctors want you to believe that Alzheimer's disease is an aluminum excess, is too much aluminum in your diet or your environment. Actually, Alzheimer's disease is caused by a deficiency of cholesterol. That's right, a deficiency of cholesterol. Not too much cholesterol, a deficient cholesterol. And then you have things like, dementia. Dementia has nothing to do with genetics. Dementia has nothing to do with getting older. There's 5 major different types of dementia, and they all have to do with nutritional deficiencies and blood flow and things like that. And then, of course, gastric ulcers. Gastric ulcers have nothing to do with stress. And, of course, doctors would take out half your stomach or all of your stomach if you have bleeding ulcers. Turns out it's caused by a bacteria called H. pylori, Helicobacter pylori, which is discovered by a veterinarian in pigs. Of course, he didn't get any credit for that. At any rate, I want you to understand that right now, insurance companies are going broke because doctors have been treating people, notice I didn't say curing, been treating people for these very bad theories that all turned out to be false. And these insurance companies are going bankrupt because all the sick people get the insurance and well people say, I'll skip it for a while. Okay? And so all the sick people, including the Affordable Health Care Act, is going bankrupt. And insurance companies some of them are right on the verge of going bankrupt. They're pulling out of the Affordable Health Care Act. People are losing their access to insurance, and this is going crazy right now. As a result, we here at Youngevity are seeing on the average about 10,000 new people come to us each month now. 10,000 are coming to us each month saying, look, we need help here. Our insurance has been taken away. Our deductibles have gone from $300 to $6,000. We're not going to refi our house to have a hip replacement. What can you do for this? What can you do for that? Well, I want everybody to get a hold of the book, Dead Doctors Don't Lie, the CD and the DVD, Dead Doctors Don't Lie. Get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and get a hold of the CD called Public Enemy Number 1 and the DVD, Somebody Needs to Go to Jail, and the book, Rare Earths Been Cures, and look at how minerals work in the body and what they can do to help give your genes, your DNA, and your RNA everything they need to maximize their genetic potential for what they do. And that's to maintain and rebuild stuff, okay? So what I want people to do is start having family meetings every month. That's right, every month. You get your 3-year-olds, your 6-year-olds, your 10-year-olds, your 12-year-olds, your 20-year-olds, your kids, your grandkids, your brothers and sisters, spouse, everybody involved, mother-in-law, anybody living in the house with you. Have the dog sit down there or lay down by your feet and talk to them too. And what you need to do is remind everybody that they can give themselves a $2,000 physical using the same test strips that doctors will use in his office for a $2,000 physical for a total of $4.50. It'll be 3 different test strips. Plus, you can take your own blood pressure. You can take your own pulse. You can take, if you even have the symptoms of diabetes, like thirst and losing weight and getting up 5 times an hour at night to go to the bathroom or during the day because you have a high blood sugar, you can go to the pharmacy without a prescription and get the test strips that doctors use that patients with diabetes use every day to monitor their blood sugar. You can do your test yourself, okay, and decide if you have diabetes or not. If your blood sugar is below 100, you don't have diabetes, okay? If your blood sugar is, say, 115, 120, you might have prediabetes. If your blood sugar is above 140, the odds are you have diabetes. So we have all these things to deal with, metabolism and healthy blood sugar levels and blood sugar issues and low blood sugar and diabetes and so on. And so what you can do is test it yourself, and then you can, use the programs we have for healthy blood sugar levels and healthy healthy sugar and carbohydrate metabolism cellular level, and you won't have diabetes in your permanent record. Your insurance rates won't go up, okay? And so what you need to do is begin to do things yourself, have family meetings, teach everybody to do this. Kids loved it. It's kind of Mr. Wizard stuff. And so kids love it, young adults love it, and of course, Granny and Grandpa and great-grandma and great-grandpa love it because it keeps them out of the hospital and the nursing home. You think about it. I mean, what you want to do is look up the diseases beriberi. Look up the diseases pellagra. I mean, all the these are not just a simple single symptom. There's 4 or 5 major problems in each one of those diseases that are caused by nutritional deficiencies of nutrients, right? And so you need to get hold of the book, Dead Doctors Don't Lie, the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book, Rare Earths Been Cures, and you would be amazed how much you can learn. And the scary part about this is, folks, when you read these books and you begin to employ this information in your families and your workmates and neighborhoods and church prayer lists and so forth. People, why should they get on a prayer list for diabetes in the church and then 20 years later have their legs cut off, they're blind, they have all the cardiovascular complications of diabetes, when they can take the programs that are designed to support healthy blood sugar, right? Guess what? You won't have a problem with these diabetes complications. But it's in your hands. You have to do these things, okay? It's kind of biblical. My people are destroyed for lack of knowledge. Faith without works is dead. You have to participate. You have to do something. You cannot just lay there and assume God's going to put his hand in your chest and take your bad heart out and put a good heart in. It doesn't work that way. You have to participate. And so you have to learn things because you're not getting it in school. Every birth defect is preventable. I repeat that. Every birth defect is preventable. But you're going to have to give young people, both men and women, the 90 essential nutrients long before they're old enough to be in the childbearing years and long after they're beyond childbearing years. Then we won't have any more birth defects. And we'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom you have for us?
I thought we'd talk about diabetes, as I've got a Fox News story here, headline, Diabetes Linked to Memory Decline in Older Adults. They say adults with poorly controlled diabetes may struggle with what's known as episodic memory, the ability to recall specific events experienced either long ago or recently. They examined the results of four series of four memory tests from 2006 to 2012 and 950 adults with diabetes and 3,400 plus elderly people without the disease. As participants who had diabetes and elevated blood sugar performed worse on the first round of memory tests at the start of the study and also experienced a bigger decline in memory function by the end of the study. According to the lead author, Colleen Pappas, an aging researcher at the University of South Florida, says, we believe that the combination of diabetes and high blood sugar increases the chances of a number of health problems. Our study brings attention to the possibility that worsening memory may be one of them. The study doesn't explore why this might happen. It's possible that the elevated blood sugar damages brain cells that transmit messages in the hippocampus, the part of the brain involved in memory. Participants were about 73 years old, of age on average, and they said they got blood tests to measure the average blood sugar levels. The so-called hemoglobin A1C test measures the percentage of hemoglobin, a protein in red blood cells that carries the oxygen, that is coated with sugar with readings of 6.5% or above is called diabetes. People without diabetes had an average A1C level of about 5.6, considered normal or in the healthy range. And they say diabetics had average A1C levels of 6.7, putting them at increased risk of complications of the disease. They also did memory tests using immediate and delayed word recall to assess changes in brain function over time. Higher A1C levels were associated with lower scores at the first memory test and steeper decline in the scores over time. This was all published in the journal Epidemiology and Community Health. So there you go. You got one more thing to worry about if you're a diabetic.
Yeah, and of course it makes sense, Doug. Thank you so much for bringing that up. Type 2 diabetes is another failed medical theory. It is not a genetically transmitted disease, as doctors would have you believe. It's a simple deficiency of a single mineral. We've known for 85 years. And nobody should have type 2 diabetes any longer than somebody has iron deficiency anemia. Guess what? You supplement with iron when you have iron deficiency anemia, and iron deficiency anemia goes away because your bone marrow cells are able to take the iron and incorporate it into healthy hemoglobin. Same thing is true. When you're deficient in that one mineral, guess what? The odds of you having type 2 diabetes goes way up. And of course, nobody's ever deficient in one nutrient. And of course, if you have multiple deficiencies, there are several diseases, which are nutritional deficiency diseases, which give dementia. One of which is called beriberi, and the other one is plagra. And these things have been known. These things have been known for 300 years. Like plagra is actually the 4 Ds: dementia, dermatitis, diarrhea, and let's see what else. Also, and death. There you go, death. You don't want to go there. Same thing with beriberi. There's all kinds of stuff involved here. Okay, and this is a single nutrient deficiency winds up with 5 or 6 major diseases. So type 2 diabetes, which is a simple nutritional deficiency, another one of those failed theories because doctors keep wanting you to believe that it's genetic. It is not. any doctor who says that type 2 diabetes is genetic should have their license taken away. Okay, and they should be put in jail because they have been practicing reckless endangerment. Nobody should have the complications of diabetes, type 2 diabetes. Nobody should die from type 2 diabetes. Nobody should be inconvenienced by type 2 diabetes because it's a deficiency of a single nutrient. Hallelujah. Well, stick with us. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie, the only time they won't, after these messages. Okay, Doug, let's go to callers.
Let's head to Cincinnati, Ohio, and Carlos, you're on with Dr. Wallach.
Well, Carlos, you're on the air. Uh-oh. We have a challenge here.
We have a problem here. Let's move on to line 3 in our next call. Usef from Iraq, you're on with Dr. Wallach.
Usef, you're on the air.
Hello, Dr. Wallach. How are you?
Okay, you have to speak up a little bit louder. I can barely hear you, Usef.
Hello, Dr. Joe Wallach. How are you? Do you hear me?
Yes, I can hear you now. Thank you. How can I help you, sir? Salam alaikum.
I am a big fan of you. I have many information about your knowledge and your product. And
how can I help you, sir?
I wanted to call you. I have a heart case here for my grandfather. He was born in 1935. He's 81 years old. He have post-herpetic neuralgia. It's a shingles virus. And I'm a pharmacist, by the way. I'm a pharmacist to be, not yet.
Okay, he has neuralgia.
I know it's an infection for...
Yep.
Yes.
Okay, we only have a few minutes here. So he has neuralgia from shingles. Does he have any arthritis or anything like that?
No, he don't have arthritis, but he have a high blood pressure, and he had a surgery, he had atherosclerosis before 15 or 20 years ago.
Okay, so he had some coronary artery disease. Okay.
Yeah.
And what does your grandfather weigh, you think, sir? What is his body weight?
Infection for Barthélemy-Zoster virus. But
yes, I know. What is his weight? What is his body weight?
His weight 80 kilos. 80 kilos.
80 kilos. Okay.
Kilos.
175 pounds. Okay. Weighs 80 kilos. He's about 175 pounds. Okay. Hey, Charmaine, this is one for you. In addition to getting rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, what program would you give him for this mix of things? He's got shingles, which is the herpes zoster, which is kind of the measles virus kind of things, and then he's got high blood pressure. He's got neuralgia from the shingles, and he's had some heart blood vessel surgery. We come back, lay it on us, girl. We'll be back after these messages. Okay, Doug, let's go right back to Usef in Iraq. Okay, Shar, we want to talk about cardiovascular disease in general. What would you do for somebody who has cardiovascular disease in general? What would you give to them just for that piece?
I would give them, to support a healthy heart and everything, I would give them 2 brain and heart packs.
Okay. And what else would you add just for good measure, the Healthy Brain and Heart Pack? And 175 pounds, I give Usef's grandfather 2 of the Healthy Brain and Heart Packs. And again, for the general cardiovascular thing, what would you throw in there?
I would give him the Ultimate Daily Classic, and I'd give him the Niacin Plus. And I'd also, for the shingles, I'd give him the Killer Biotic.
Yeah, shingles is Killer Biotic. Shingles is an infectious disease with a virus, and Killer Biotic is a blend of 8 herbs which will support the immune system. 2 of them have antimicrobial properties. What would you do topically for shingles, which are your little blisters and things? This infection is in the skin. And usually this is in older people when they get shingles. Can be in kids, but it's 99% of the time, I think, in older people. They're stressed out. They don't have enough nutrition. They have some other chronic problem. And this herpes zoster virus jumps on them or comes out of hiding and flares up again. And what would you do for the discomfort and the pain associated with that, and also active infection in addition to the Killer Biotic?
I give them the colloidal silver.
Yeah, I would just apply topically on those blisters the colloidal silver, just soak a cotton ball, and Usef put it all over the place, even if there's no open blisters, even if there's just like terrible pain and where he's had the blisters historically, you can put the colloidal silver directly on that, of course, and again, the Killer Biotic. And then for the general body health and need for cardiovascular stuff, at 175 pounds, I'd give him 2 of the Healthy Brain and Heart Packs per month. Stay away from all the bad stuff, no fried foods, no processed meats, no oils, or gluten. And it's kind of a process. It's a system. It's a diet. Support the body's ability to maintain, repair itself, and defend itself. Okay, how much time we got here, Doug?
We got enough time to get one started here. Let's head to Chicago, Illinois. And Thomas, you're on with Dr. Wallach.
Thomas, you're on the air.
Okay, Dr. Wallach, thank you.
Yes, sir.
There's something I heard you say the other day, and I'm trying to find out what's the best way to go with this. It's in regards to when I move a certain way, I leaned over to pick up some sheet music, and my heart picked up speed. And I noticed if I lay flat or move it back, this thing stops. So I'm trying to find out. I heard you say something about.
We already know what your problem. Yeah, we already know what your problem is there, Thomas. How much do you weigh?
Well, I lost the 3 pounds you told me to lose. Well, not that. I lost weight. I'm 194 now, 5'9".
Okay. And do you have any other issues? Uh-oh.
Yeah, because I'm on the Heart and Brain Healthy Pack. We talked last week. And my blood pressure has started to come down. I listened to you and Dr. Gerhard Strauss. I'm on the selenium. And
okay, now hang on. We'll be back. And I ask you one question before we go to the break. Do you have a history of a back problem?
Not to my knowledge.
Okay, we got to run. We'll be back with you, Thomas, after these messages. Okay, Doug, let's go right back to Illinois and Thomas. Okay, Shar, this is a Shar thing. Every time Thomas, well, I shouldn't say every time, but many times, of course, Thomas has been on our program for a couple of weeks, and his blood pressure is coming down. He's lost a little bit of weight. That's pretty good for just a couple of weeks. But he has a history of having a fast heart rate, which is technically called tachycardia, if he bends over, if he changes position. And before he went off the air, I had asked him if he had a back problem. He says, I didn't think so. First of all, do you have to have pain in your back to have a back problem?
No, absolutely not.
Okay, very, very good. And so what's a high probability and what's going on here with Thomas in this fast heart rate, this tachycardia, when he changes position?
He's got AFib.
Okay, most doctors would actually diagnose that as AFib. You're quite correct. But doctors think this is a heart problem. They'll run up $500,000 worth of cardiovascular bills, and then, of course, insurance and the government will pay for all that. But still, they're not going to help the guy or gal because it's not a heart problem. What is it?
It's basically a mechanical problem because he's shrunk enough that he's lost enough cartilage between his vertebrae that they're squeezing the nerve going through his backbone into his heart. You
got it. So what's happening here, as Shar said, when you have tachycardia, rapid heart rate, or atrial fibrillation, AFib, when you bend over forward, when you reach up on your toes and try to get something off the top shelf, you lay down at night. It gets worse when you lay down as opposed to when you're standing up. It's worse in a lazy boy chair than when you're in a upright chair. This is caused by people shrinking, as Shar said, and they get what's called degenerative disc disease. The disease get thinner, the vertebrae get closer together, and they smash the roots of the spinal nerves, which actually control the rate and rhythm of the heart. And whenever you change position, it squeezes those nerves, squeezes the roots of those nerves, and causes the heart to race and palpitate and do funny things. So what would you add to the 2 healthy brain and heart packs that Thomas is taking? What would you add to that to support healthy maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, and so on.
I'd add glucogel, and he needs to take probably 15 to 20 a day for a while anyway.
Yeah, I'd have him take 15 minimum, up to 20. It'd be 5 at breakfast, 5 at lunch, 5 at dinner, plus 5 at bedtime with a glass of water. And this is, again, to support and promote maintenance repair of connective tissue, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone mixture, bone cell. And then call us in another 2 weeks, 4 weeks, 6 weeks, and we'll walk you through this, Thomas. But it sounds like a pretty straightforward problem, which is quite common. And we'll walk you through this. Okay, Doug, let's go to callers.
All right, let's stay there in Chicago and head to Dave. You're on with Dr. Wallach.
Oh, Dave, you're on the air.
Yes, Dr. Wallach, thank you for taking my call. It's always a pleasure talking to you, sir, and thank you for your help.
Yes, sir.
I got a person with 190 pounds, 5'7", 56 years old. He's had glaucoma and retina detachment. He's a diabetic person. And he's asking me if there's a way that his retina can come back to its place if we do nutrients, sir. And
Okay.
glaucoma, please get better.
I got you. Yeah, the glaucoma and retinal detachment, and he's got diabetes, correct?
Yes, he's diabetic, sir.
Okay. And so, again, this is a SHAR thing. What would you do for a dietary thing? What changes does this fellow need in his diet, Shar?
Well, he needs to get on a gluten-free diet, and obviously no sugar because he's got diabetes.
Yeah, I got to get rid of all the bad stuff. No sugar, no gluten, no wheat, bread, rye, oats, no fried food, no processed meats, no oils, no gluten. And what programs would you give him for eye problems? Let's just look globally at all eye problems, vision problems, remembering that the eyes are part of the brain. The brain is part of the eyes. So what would you do there?
Well, I would get him 2 healthy brain and heart packs, and I'd also add the Occutive to it.
Okay, the Occutive, absolutely. And they come 30 in a bottle, so he's going to need, if he has glaucoma and, detached retina, and just like it would for anything else, he's got some serious things that he could lose his vision. He does not want to stop his medication. He's taking drops to keep the pressure down in his eyes. He can only reduce the amount of drops he's taking to reduce the pressure in his eye based on the actual measurement of the pressure when he goes to his doctor. Don't just blindly do it. No pun intended. And so, yeah, I'd get him 2 bottles of the Occutive, so he could take at least 1 twice a day. If money's not a problem, I'd go for 4 bottles, so he could take 2 twice a day of the Occutive. And what would you do for blood sugar problems?
Oh, he needs to add the Sweeties.
Yeah, I'd have him take 2 bottles of Sweeties a month, so he could take 3 of those twice a day, and 3 at breakfast during dinner time. And if he's on medication, as his blood sugar drops, and it could, he can reduce his medication based on his doctor's instructions, which they do. And, of course, free radical damage aggravates diabetes. Free radical damage aggravates eye problems. And glaucoma can also be indirectly related to vascular problems. There can be obstructive artery disease in the eye, contributing to glaucoma. So what would you do? You're already going to give them the Healthy Brain and Heart Pack, the Sweeties, and the Occutive. What would you throw in for vascular health?
Probably vascular
like my
health?
daily prayers? Like my daily prayers?
The Ultimate Daily, the
Ultimate Daily
Classic.
Classic, you got it. Okay. 3 of those twice a day. I'd have them take 3 twice a day. That'll be 2 bottles a month of the Ultimate Daily Classic, and that's to support healthy blood flow in all the blood vessels of the body, including the kidneys and the eyes and the brain and the heart and so on. Give us a call. Let us know, say every couple of weeks. Dave, let us know how this fellow's doing with his weight, with his, because he's a little bit heavy. He's probably 30 pounds overweight. So we need to work on that. We need to know what his eye doctor says about his eyes. We need to know what his blood sugar is and so on. And we'll walk you guys through this. Okay, we got time to start another one here, Doug?
We sure do. Let's head to Arkansas. And Anna, you're on with Dr. Wallach.
Well, Anna, you're on the air.
Hello?
Hi, you have to speak up a little bit, kiddo.
Okay.
Yeah, it's much better. Thank you.
Do I repeat what is wrong?
Okay. Yeah, tell me what your problem is and how long you've been taking longevity products.
Well, I have lower back pain, and then in the middle of my thigh, and then the side of my thigh, I have pain. My ankles and hips, and then My knees, like inside and the side.
Okay. And how much do you weigh, Anna?
118.
Okay. And have you been taking longevity products yet?
I've only taken Tresmadol pills.
No, I'm not talking about. I'm not talking about prescriptions. I'm talking about longevity products. Are you taking any of our company products?
Oh no.
Okay. All right. Shar, here's a young lady, Anna, who's got back pain with all this stuff going on in her ankles and her thighs and her feet and her hips and so forth. What do you think is going on here?
Well, I don't know. She sounds like she needs some glucogel.
Well, she has a musculoskeletal problem, right? She's got a musculoskeletal problem in general terms, and the odds are this back pain resulting in all this pain going on down her hips and her legs. This would be called a peripheral neuropathy. Okay, you go to a chiropractor, he's going to call it sciatica. All right, because the pain is originating from the sciatic nerves being squeezed in the lumbar area because of degenerative disc disease and bone spurs and all that kind of stuff. So it's a musculoskeletal problem. So when we come back, Shar is going to give us a supplement program for musculoskeletal stuff in a 118-year-old person after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 95 Crusade. And Doug, let's go right back to Arkansas and Anna. Okay, Shar, this is a 118-pound young lady. She's got a classic musculoskeletal problem that chiropractors would call either peripheral neuropathies or sciatica. What would you do for this lady?
I would give her a healthy bone and joint pack.
Okay. And would you add anything extra for the discomfort in addition to the CM cream, a topical cream you can add? Would you put that on her feet or her back?
Well, on her back, obviously, but I would also she could put some trauma oil in it, which would help it work better.
Yeah, exactly. The trauma oil is a blend of oils, or aromatherapy oils is a blend, as the name implies. It's for when you get injured and you have an owie, but also for chronic pain, from everything from bone spurs to disc problems, low back problems, and sciatica, neck problems. Anytime you have chronic pain, muscles, ligaments. And so you can, as Shar says, I would put 5 or 6 drops of the trauma oil in every teaspoon of the CM cream you're going to apply. And I would apply it particularly lavishly to the lumbar area of the back, the lower back, go right down the middle, an inch on either side. And if you want, you can also take orally. What could she take orally to also help relieve some of that pain?
Orally to help pain?
Mm-hmm.
Boy.
Oh, how about CM Plus capsules?
Oh, yeah. Okay. I'm thinking of a drink or something. Okay.
No. See, I didn't say drink.
No,
CM Plus capsules.
Yeah.
Okay. CM Plus capsules. Go ahead and take 3 of those twice a day, be 2 bottles a month, and that's going to help relieve inflammation and relieve pain. And so this is something you can do every day. It's not prescription. It's not an opioid or anything like that where it can kill you. It's safe and gives you extreme relief of pain and inflammation. Okay, how much time we have here, Doug?
About 2.5 minutes.
2.5 minutes. We got time for another one, you think, if we go quick?
Yeah, let's head to Huntington Beach, California. And David, you're on with Dr. Wallach.
Hello, David. We only have moments here, so get right to it, please, sir.
All right. I'll try to be as fast as I can. Hello, doctor. Pleasure to meet
Yes,
you.
Sir.
Please bear with me so I can tell you all my issues so you can accurately tell me what to do. I'm 27 years old, 5'10", 160 pounds, body fat approximately 9 to 13%. Perfect blood work, normal blood pressure. I had asthma as a kid. Sometimes the sun causes mild dermatitis or eczema, which is accompanied by an itchy feeling on my arms. Eating dairy causes acne on my face. Going forward, my main issue is I had a bicycle fall about 2 years ago, dislocated my right shoulder, separated my left shoulder. For my right shoulder, I had a bony Bankart lesion on the glenoid and labrum. And
okay, we have to stop you there because I'm not going to be able to answer the question if you keep talking. So, obviously, you have two things going on. Shar, what's his basic underlying problem from asthma and eczema?
He's definitely got a gluten intolerance, no question about it.
So you have a malabsorption problem. You have a trauma falling off your bike. So what would you give him, Shar, to deal with the various manifestations of trauma, bone, ligaments, dislocations in the shoulder, and all this kind of stuff, musculoskeletal stuff?
Well, to help the musculoskeletal, I would give him 2 healthy bone and joint packs.
Okay. And again, for any place you have pain, in addition to the healthy bone and joint packs, I would go ahead and put the trauma oil, 5 or 6 drops in with the CM cream, apply that to the painful places. And what kind of diet must he be on to deal with the asthma and the eczema?
No wheat, barley, rye, or oats, no gluten.
Okay, you finally get an A+ here, kiddo. We'll end up with an A+. You've got a bingo there, a bullseye. He needs to stay away from all bad stuff, no fried foods, no processed meats, no oils, no gluten, no wheat, barley, rye, and oats. And it wouldn't hurt to get a hold of that CD, Serial Killers, because it goes into most of the places you're going to find hidden wheat, barley, rye, and oats. Most people don't even think about it. People say, I know I'm gluten-free and I'm still lighting up like a light with my eczema and my asthma's never been worse. That's because you're getting hidden gluten, okay? And you have to know the hidden places. And so that's why you want the CD called Serial Killers. Okay, how much time we got? Well, that answers that question. Thank you so much, Shar. Super job as usual. We had a lot of great testimonies and questions today. Thank you so much, Doug and Sam. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.